My name is Dr. Euhana Varigos, and I'm from Melbourne, Australia, and I'm an anaesthetist. And the PBM equipment I use is the very well known to most of you, I suspect. THOR LX2 system is the one that I use the most, and I follow the THOR classification and dose guidelines. I use a Radia, I use a Laser X, which is an Australian laser, and also Silver Bar. This is the treatment chart, which I'm sure you're all familiar with. Some case presentations. Mr. TW, right forefoot surgery and right total ankle replacement. This was an urgent referral from a surgeon I work with. He'd had some right forefoot surgery 7 days prior, but had lots of pain and swelling. And he had a history of a very complicated left total ankle replacement previously, with delayed healing and infection, where he was in hospital for several weeks. So the surgeon wanted to preempt and help improve this surgery, improve the operation for prior to this next operation of the total ankle replacement. So I treated the patient several times. We had a closure of the incision, and we could go ahead with the definitive surgery. I treated the patient again prior to the surgery, but 1 hour prior to the surgery in hospital. My advantage of being an anaesthetist is that I can actually see patients pre-op in hospital and post-op before discharge. I did that with this particular patient, and he was on Panadol after 5 days. So he was not on any hard medication and strong medication. And the difference to that first total ankle replacement, he still is, he can't believe the difference compared to that first op. And this is the 3 weeks post-op, before and after treatment, just showing here that this is not that much swelling for 3 weeks post-total ankle replacement. And that's the before treat photo. And after PBM that day, you can see there's a reduction in swelling here and here. Next patient is someone who had a severe blister from the same surgeon, but this was after a plaster came off. After the treatment, this is what we got. So that improved the healing underneath that blister. This is JD. This is a left total hip replacement. Again, an urgent referral 3 days post-op from a left total hip. She was in hospital, of course, still. She had hemorrhaged, pain and swelling, and she was requiring 3 units of blood. So severe pain, immobility, and she was very distressed, and the bleeding was all the way down the leg. But that's just an example of how I was presented at 9 p.m. on Tuesday when I saw this lady. And she couldn't move. She couldn't go to the toilet. She couldn't do anything. She was very distressed and vomiting on the narcotics that she was having to take. So I treated her that day, that night, and she immediately felt better and was very thankful. I treated her the next day, again, very thankful. The bruising was coming down. She was able to walk. She was coming off those tablets. And the best thing was she said she could actually go to the bathroom. Thursday and Friday, I was unable to see her. However, I saw her on Saturday, so for her 3rd treatment. And this is how it looked. So you can see that there's been a big difference from that first, I didn't arrow there, but the first photo. And then I treated her on the Sunday again, and that was the result. So still a further improvement. So every time I treated her, there was visible improvement, and this improvement was all the way down the leg. So this patient, in 4 days, Tuesday to Sunday, it was dramatic, and the physician is still commenting how he thought she would be in hospital for another week at least, or 10 days. So longer than she was. She left the next day. So again, this is the beginning. This is the bruising, which you can see it's dense. And that's after the 3 treatments. Again, it's improved, still residual bruising here. And finally, after the 3rd treatment, the 4th treatment on Sunday. And here's an example of a hematoma, not surgical, but again, the same idea of treating the patients to which she had a very severe injury, very periosteal bone bruising, so very painful and swollen. And after, I think it was 6 treatments in the end, because she wanted to go to her daughter's wedding, you can see that this is totally gone. She was a psychiatrist, so she was very happy with the result. A patient now who had left total knee replacement and right total knee replacement. I was involved with both of these, and she was referred to me, this is a while ago, for pre-op assessment and pain management because she was overweight, very, very anxious because she was young. She was in her 40s and needing a total knee replacement too. So here it is 8 days, so after the pre-op treatments, and then 8 days post-op. And you can see she's not a small girl. And then we can see that that's very good movement for someone of her size for 8 days. And then after, this is before the treatment, you can see that there's the angle she could get to. And after the treatment, we've reduced her angle or increased her flexion substantially. FC, left total knee replacement and left elbow arthroscopy. This patient I only saw immediately pre-op for her her knee replacement, left knee replacement, but it was a very complex knee replacement. This was her fracture that she occurred 3 years earlier, and this is the hardware she presented with prior to her knee replacement. And she's 59 and she had swelling for 3 years, which she could not get rid of. So I saw her on the night before surgery in hospital, and I treated her basically with THOR LED and cluster to help with swelling, to help with pain and anxiety with silver bow. I use a silver bow laser to do a lot of that work. But the main thing was the swelling reduced dramatically. 3 years it had been swollen. She'd never seen it come down like this. She had a dramatic diuresis, and still comments to people how that was the most amazing thing she ever saw. But what it did was it prepared her for her surgery. So when she had her left total knee replacement the next day, the surgery was the whole knee was much optimized for surgery, and the swelling and her lymphatics had been stimulated, so her post-op swelling was negligible. One of the big things she noticed, first of all, she had good flexion and extension was immediate. But the other thing she noticed was all her scars, the scars that she'd had 3 or 4 surgeries for, all of them were less sensitive, and especially the one that had been reopened for this operation, which had always been sensitive. And this was using the 660 nanometer active scar treatment, which I showed before. And one of the big things about CRPS patients is to treat contralaterally. This is one of the first cases of the CRPS patients that I wanted to mention. So Mr. RM, right total knee replacement. He had his total knee replacement in January, and I saw him 6 months later. I was referred, and he had an inguinal hernia repair. So 2 operations on the one side. And he had significant CRPS symptoms with sensitive scar and pain and reduced movement. He was unhappy with the result and concerned after 6 months to not be able to move his knee properly or walk properly. This was when I first saw him. This was a week later, 28th, and that's a couple of treatments later. So what I want to show you here is the first treatment. We had after the first treatment, so this is already an improvement, 80% angle here, 70%, and we've got it to 63. So you can see his knee flexion was improved dramatically, and he was very happy because not only did that happen, but that whole pain and sensitivity of his knee reduced, so he was walking more normally. I did not treat that knee. I always treated the left side. So he had no active laser on that side, but with no active laser on that side for 4 treatments, I was able to get a reduction and improvement. And I've had patients who have come to me before where they've had acupuncture, laser, things done on the side, and they don't improve. But when you treat contralaterally, you can get an improvement. And after all, that's what we're wanting to do. Mr. NG, plastic surgery craft. So he was a patient who was sent to me a while ago because he had definite CRPS symptoms on a graft. And with contralateral treatments, there was definitely improvement. And he he got to the stage where after quite a few treatments, though, I was able to eventually treat locally. But this is the first treatment. This was how he came. I didn't touch that side. I treated contralaterally the other side, and you still, in half an hour, we got a change. You can see there was a change in the microcirculation, and that's the autonomic nervous system effect. It's a sympathetic effect, actually, sympathectomy effect. I've done many sympathectomies in the theatre, and I saw that I was obtaining a photobiomodulation sympathectomy effect, is what I call it. So treatment aims. The treatment aims are to restore normal limb function, to restore sleep for any patient, but perioperative patients, to reduce nerve pain. All patients who have surgery are going to have an aspect of nerve pain, but to do this without producing pain. So if patients have nerve pain and they've got CRPS symptoms, you must not treat that side to begin with, in my opinion, because with treating that side, you have a high percentage of incidence of producing more pain. So perioperative treatments in summary. If there are any positive CRPS signs, treat the contralateral limb until symptoms decrease. So once you get the symptoms decreasing, then you can slowly introduce a more local targeted treatment for the side that's affected, and use your laser. And THOR, I use near infrared, but also red laser, but locally, rather than doing a lymphatic treatment on these patients when they first come. You do that all contralateral. If there are no CRPS signs, you just do your straightforward lymphatic treatment, analgesic treatment, and local scar treatment for patients, and you will get some help patients in their perioperative journey. Thank you.